Hey, this is Doug Field, along with my co-host Brent Macy, and welcome back to this segment of HealthCare Consumerism Radio. We've got a great segment coming up because we've got a very dear friend and probably one of the most prominent thought leaders on consumerism in the space, member of our League of Leaders, former winner of our J.J. Robbins Memorial Leadership Award, former Senior VP HealthCare Consumerism Cigna, and currently CEO of Consumerdriven, LLC. And Mr. John Young, good morning.
Good morning. Can you hear me okay, Doug?
Got it, John. Yeah, we got it.
Good.
How's it up in the frozen chosen this morning?
Well, guess. Just guess.
I had to throw that one out there a little bit. So. Hey,
I think that's why a lot of innovation comes out of Minnesota, because we're just, we can't go outside and play.
So
we just think.
Keep your pajamas on and do some thought leadership and do some brainstorming, right?
That's right.
Well, John, hey, great to have you on here as always, and great to talk to you. And today we want to kind of have you give us kind of an insight. You're out there across the space, touching base with the private exchanges. Certainly plugged into what's happening with HSAs, and so let's talk a little bit about exchanges. And what makes exchanges a part of healthcare consumerism?
Oh, it's just a natural next. It's kind of like consumerism 2.0. I mean, the first true consumerism plan. I mean, the one that gave people financial incentives within the plan design was back in October 1999, and it was Medtronic, and that was the first health reimbursement arrangement. And basically, the industry has kind of moved in a similar fashion for many years. Basically, the plans are designed. The employer kind of picks the design, picks the carrier, and then gives it to the employees and basically says, we want you to be more prudent consumers of healthcare services. So we're giving you some financial incentives within this plan design. And I think these exchanges take it to a natural next step, where it's adding an environment, particularly more effective with a defined contribution strategy, where the employer is giving a set amount of money that the employee can decide how to distribute amongst various plan options. It makes it more of a shopping experience, and people are selecting plans based on individual need. And then the chassis of that, I like that, the benefit administration on steroids idea is the chassis, and that's the chassis. Yeah. So it's an evolutionary part. You're just basically saying, we now not only do we want you to be prudent in healthcare services purchasing, but now we want you to kind of choose your own coverage, your own plan.
John,
maybe your own insurer,
Yeah, John. When you look at these exchanges, what are people selecting when they're in there?
Well, this is what excites me the most. Okay, so they're self-selecting to take more money home when they're given that defined contribution in that defined contribution scenario. They're buying higher cost share plans. They are self-selecting those, meaning they are taking HSAs. I've referred to this as kind of a Diet Coke Mentos moment. If you offer an HSA within an exchange, people are going to take it. I mean, the normal participation out there in plans are 10, 11%, depending on what survey you read. I've got some data I want to share with you from a few sources. The organization that put defined contribution healthcare on the map are the great people at Bloom Health, and 48% of Bloom members, this is brand new data for 2014 enrollment, okay? 48% of their members enrolled in an HSA-eligible plan. And what's important about this is that this isn't their first rodeo. So the people that have been in plans in this defined contribution scenario, over multiple years, 95% of those people that had an HSA in year one, they re-enrolled in the HSA. So that basically is saying, okay, we get it, we're working with it, we like this type of benefit. So that's Bloom data. Liaison says that 65% in their book buy an HDHP, with 80% of those opening an HSA. And then there's some interesting data out of Ann Hewitt, the choices both at Darden and Sears. Turned out it looks like that 42% of employees opted for a leaner plan. Of that, 39% selected a consumer-directed plan. Now, remember, in an exchange, as much as I love account-based programs and HSAs, I think it's important to note that in some environments, in most environments, some employees are going to select higher value plans.
Right.
In the A.M. Hewitt data, a quarter of those people selected richer plans because based on their family needs. There's a local company, Hubbard Broadcasting, that had all HSAs. That's all they offered. Mm-hmm. They were full replacement. And then they put in an exchange. And it still turns out that the majority of people, nearly 90%, take HSAs, but some select other types of plan designs. It is giving people more choice, which is consumerism.
Yeah, I agree with you, and I think it's a good point about the Bloom data. There's some in the industry that kind of push back on some of these stats and say, hey, the consumer is not making an intelligent purchase. But I think the Bloom data supports the fact that they actually are, because they're renewing in the HSA.
Yeah,
John,
I think it depends on how it's done too. Bloom has a decision support on the front end.
Yep.
That might be more educational than maybe some of the other exchange execution that's going on out there.
John, with all this adoption in the HSAs, with these numbers that you're putting out, what do you think are the important next steps in this whole evolution?
Well, I think this almost goes back to the evolution question. Let's look at the person today, right? Carnegie Mellon University puts out a survey last August that basically said 14% of us in America understand the terms deductible, coinsurance, co-payments, and out-of-pocket max. And I'm afraid those 14% are the people that work in the industry, that there's such low health literacy. It is, and there's such a behavioral economic issue that we have to overcome that I think the next steps are all about decision support. They're all about helping people understand. Oliver Wyman, they came up with a term that I just think is brilliant. They call it the rise of the sovereign consumer. The sovereign consumer, and that is the point of these exchanges and carriers that are on the shelves of these exchanges vying for that consumer to pick me. Yep. And today the consumer doesn't understand how the health system works, doesn't understand their health plan, doesn't understand the value of an HSA. They're disconnected. They're unengaged. No matter how much we try to say we've got resources and we're trying, we have got a pathetically uninvolved consumer. And I think these exchanges are going to change that. And I think especially it's going to force solutions to help them do that, to help them improve their financial responsibility, to help them understand the cost of health care. When exchanges talk about transparency, they're talking about the pricing of products within them. But we have to help people understand the prices of medical services, great companies like Castlight, HealthSpark, Change Healthcare, Healthcare Blue Book, the organizations that are out there that are putting real price and quality information in front of people. And then great companies like Wiser Health that are helping people make different care decisions based on clinical evidence and personal preferences. That's the stuff. That's the stuff that people need, because the next, that sovereign consumer is, they're going to be far more aware. They're going to be demanding, and they're going to be more needy. And in this cusp, the exchange, the big opportunity now is to fill that need, to take people right now who are completely kind of lost, despite our best efforts, to really help them get through the behavioral economics issues and to really embrace what they're deciding on to do.
Yeah, John.
So making there's so much. We could just spend the whole hour on this, but frankly, it's just making it clear, making it simple.
Yep.
What's in it for me? Helping people understand what's in it for me. Helping them navigate. Giving them call centers. Addressing those concerns about this change. Frankly, we have to really do this up front. When people are approached with this new approach, they look at all changes with a little bit of suspicion, And it must be good for the employer and not for me. There's a lot to be done in the midst of helping people embrace this. And a lot of great organizations are going to step up. But I think we cannot treat this just as a benefit administration on steroids. It has to be far more supportive. And frankly, I think health plans have the right. I think they could have a beef and say, look, we do this. We're doing this. I know at Cigna we did this really well. I'm sure Aetna and United, they do a very good job of providing people resources, tools to help navigate and that sort of thing. But if exchanges are going to try to get in that relationship with that consumer, they're going to have to provide that kind of level and even more.
Well, the health plan, I mean, they're partners. The exchanges, the health plan, the transparency players, it's all a common group. And I would go as far as say, the biggest change is coming with the employers themselves. The employers are becoming the consumer because they've got to take care of their employee population who are becoming the consumers. So there's just tremendous education and change going on, within the whole food chain.
Yeah, and we can't forget the employer. It turns out that health status is more related to job satisfaction than the results on your health risk assessment. That's from Gallup. I mean, their cultural, the career fulfillment that individuals have with their employer is absolutely fundamental core to improving health and keeping people in a higher well-being. It's much more holistic. So you're right. The employer has to still take on a big role with that kind of consideration.
John, there's a lot that we've just talked about, and we got about a minute and a half to go. So I want to give you a chance to really compress this into some clear takeaways for our audience. Take about a minute and give our audience some clear takeaways.
Okay. First of all, different projections out there for growth, but it's going to grow. EBRI says maybe 15 million by 2020. We've got like less than 1 million in these exchanges today. Accenture says 19 mil by 2016. Oliver Wyman says nearly 40 by 2018. Point is, this thing is going to grow. There's a recent survey done by the Private Exchange Evaluation Collaborative that basically said 45% of employers think they'll be in an exchange before 2018.
Right.
And there's so many differences out there, so many different flavors, carrier-owned, variable models that there's many carriers on the shelf. There's fully insured. There's self-insured. There's reasons why they choose these specific types of flavors. The Ann Hewitt models is all fully insured, which is that really helps the health plan have the incentive to keep costs down, as opposed to just a claims pass-through like in an ASO general environment. I mean, so that's what they're banking on. Variable models from other types of advisor control. There's so many different options. But I guess I would like to say this, if I have just a few more seconds, is that despite this awesome year-over-year growth that we've had in CDH plans, CDH plans are only covering about 20% of Americans with only, and like you said, about 8% take an HSA qualified plan. Mm-hmm. And that's exciting, but I think it's a fizzle because these are proven ways to get people healthier and to lower costs, and enrollment should be much higher. And exchanges and defined contribution are the way to get there. That's what's going to change the game. There's going to be much higher adoption. It's going to be a better chassis to drive enrollment to consumerism plans. So we have to fully support. There's those differences I think we all need to embrace. Not all types are going to appeal to others. But for this to work, health plans have to participate or choice goes away. And without choice, there's no need for these exchanges. So
hey, John, not to cut you off, but a lot to talk about it, and I want to make sure our audience hears on this segment that they can come and hear you at, IHC FORUM in Atlanta. John will head up our general session on defined contribution exchanges. He and Todd Berkeley will also do a lunch and learn after the pre-cons on HSAs and the exchanges. So I wanted to make sure our audience heard that. You can join John here in Atlanta in May. And John, thanks so much. A lot to talk about. We'll have to have you back on soon.
Okay.
Take care, my friend. To our audience, stay tuned for the next segment, HealthCare Consumerism Radio.